Hello, everyone. My name is Tim Mikhelashvili, host of the 2025 Medical Innovation Olympics. This is an event that you probably have been hearing a lot about lately. Every week, we're sharing with you new details. We're unveiling certain different speakers, agenda, which we'll be doing today. We have 2 months until the main event and less than 3 weeks until competitors, innovators, and champions in healthcare can actually submit their concepts and products into the second session of the Olympic trials. I'm here again with my distinguished guest, investor, scientist, innovator, independent thinker, John Hemming. John, please introduce yourself to our
Well,
audience.
I've done various things in my life. I've created tech companies. I still run a tech company, actually. I've been a member of the UK Parliament, including the Regulatory Reform Committee of the UK Parliament, which looks at regulation in a more general sense. Obviously, medical regulation is quite a big issue. I'm a musician, in fact. In fact, you can hear my music on YouTube if you look close enough. But more recently, I've been heading up a team of biohackers who've been trying to solve some interesting medical questions.
Yeah. Great. Well, why don't we tell everyone again why they need to compete, what the experience
Shall I go
is
for that?
they
I
can
think
expect.
I took part. I took part last year, and one of the challenges is you need to be able to run your if you've got a new idea, you need to be able to run your idea and promote your idea without the risk of things going wrong. So if you go to some investors and you have a problem with your idea, you won't get money from them. With the Olympics, the Medical Affairs Innovation Olympics, you'll get advice. You might win a prize, you get some promotion, but most importantly, you have a dry run of putting forward your idea and having it challenged in a friendly and supportive environment, but it's still going to be challenged and in such a way as it won't do you any harm in the long term. And you can learn from that. And that's very important.
Yeah. You were competed last year. We had a lot of debate. You were highlighted in articles that were posted later. We had podcasts that as well that were repurposed from that event. So it's a huge, exposure for
Yeah,
marketing for you as well.
it's an opportunity. Yeah,
Yeah.
if you've got a new idea, if you've got a new idea, you want to promote it, you want to discuss it, and this
Yep.
is one of the few opportunities to do that, which isn't very difficult to achieve. So if you went, you go to a VC, and if it don't work, you don't get anywhere with it, and that's it. That's you've missed your opportunity.
Right. Yeah, and that is a key. It's key in differentiating those successful innovators that people hear about from those other just as intelligent innovators who may not find the right place, the right setting, or the right person to share and communicate those ideas with. And that's what we're providing. We're going to have several virtual venture capital investors, angel investors as well. That list is growing. We're adding speakers, and that's what we'll talk about here. But let's talk about the two categories in which we'll be giving out $5,000 prizes: concepts or products. So products that are ready for deployment versus concepts that are earlier stage. Each will have their own respective voting criteria. You'll hear live feedback from our expert judges. Okay. And there are 6 innovation tracks: drugs, devices, diagnostics, medtech, marketing, and medical affairs. All right. So if you are a consultant, you're a student, you're an employee, get your approval from your organization. If you're an employee, let them know that you're taking, part in this event. Invite others. If you're an entrepreneur or founder, you're more at liberty to attend or to compete. Now, why is this an exciting competition, right? Or event? Well, because there's going to be a lot of learning with a lot of speakers, and I'm going to highlight the agenda that we're working on right now. We've pretty much finalized it. We may have other speakers last minute surprises, okay, as we always do every year. But we'll share that. So learning, right? Learning information in a very focused environment where you set time aside to be innovative, to challenge yourself, right? And then the second part of it, this is really competition, challenge. When you compete with the intensity that the Olympics really represent to all of us, right? The intensity and the quality of the performances that we usually see, right, at the Olympics, you try to do your best. Okay, this is not just a pitch competition. There's going to be multiple rounds of elimination, right? So we recommend not to present the same information every single time, but to give a glimpse of how you think as a founder, as a competitor, to our expert judges. John happens to be one of them, as well as others. Okay, so let the feature different parts of your concept or product. Okay, answer questions. This is a 16-day dialogue and beyond. They will become your mentors, that as well may work together with you, may help you iterate the right ideas, as you mentioned. So that's the kind of environment that's unmistakable, that's memorable, that goes on every year. And we have volunteers such as John who are helping me organize this and keeping the momentum going and accelerating innovation. That's the idea here. We also have a couple of announcements. We were just nominated and shortlisted from a long list of candidates as one of the top 4 innovation challenges in the world by Fierce Pharma Biotech. There's going to be a gala on September 10th when we'll find out the winner, but we're very humbled and grateful for this recognition as a very unique innovation challenge. That's number one. Second announcement is that there is a new podcast called Off Label by one of the first early expert judges and media partners, Steve Royal, who participated in this event since 2022, that's now published. He just released it today. I'm joined there by one previous competitor from 2022 as well, Pallavi Jain, who currently works at Ipsen Pharmaceuticals. So check out that episode if you're thinking about, competing or attending. Okay, we're 2 months away. October 6th is the opening ceremony. Now, I'm going to ask for some just comments from John on the topics. Let's reveal the agenda, okay, as we have it currently. We're going to start to talk about our theme. Okay, we're going to set the stage. Layer the science, leap with defiance is this year's theme and slogan. As tradition has it, we always have Olympians. Chris Cook from Great Britain, double Olympian swimmer, and also Alex Giorgetti, a world champion in water polo, also Olympic silver medalist, currently lives in the United States in Florida, originally from Italy. He represented Italy at the time. He'll be joining us as well. Okay. Then we'll have Sandra Walker, an executive in commercial, government affairs, medical, talking about neuroscience approaches to eliminating bias and in accelerating innovation. Han E. Lee, tremendous leader with global experience in Japan, Korea, US, transforming enterprises in medical affairs. She's at Pfizer, an international medical lead in vaccines. And she'll be talking about driving change during tough times that we have today in the healthcare. Here are our competitors. And this is where I want to take a pause and challenge you watching this to join these leaders. They participated in the first Olympic trial session in June. Okay. There's others who are currently submitting their concepts. We're looking for more in medical affairs, in marketing as well. We have quite a lot in medtech, drugs and devices and diagnostics. And so join these competitors here. These are the faces and names from all over the globe that a lot of us will become more familiar with very soon. All right. Then we'll go into some innovation trivia, okay, as we always do. And then get to know each other, form deep networking. That's reminiscent of the Olympic Village spirit that we're committed to upholding every year. All right. So you talked about music and YouTube, John. Music is going to be certainly one of the breakout rooms, as well as others. Personal development, Olympic sports for sports fanatics out there, hobbies, technology. Okay. So hobbies is kind of that umbrella term where many other miscellaneous kinds of interests may fall. So we'll get a chance to get to know each other. All right, investors, we'll get to know competitors, attendees, students, volunteers, and others. Okay, then we have this session with various different executive perspectives from medical affairs, from AI, from software, with 4 incredible leaders, okay, talking about health system readiness for AI and innovation. Chris Piedmont, our investor expert judge, and I will do a one-on-one interview, talk about how to create momentum, converting our performance and behaviors into mastery of performance, okay, into using the kinds of metrics that can deliver the results based on realistic views of how we perform, how we collaborate. A lot of the innovation is also dependent on whether or not a patient can have access to it, right? Yes, we're excited about the innovation, but ultimately, patients have to reap the benefits of the innovative drugs and devices that we have. So Emily Phillips and Alan Gray are experts in this in this field. So this will be a very important discussion here on what counts most today in those paired decisions. Then we'll dive deep into medical affairs, how to transform strategy into results, once again, by adding structure, KPIs for high performance in this environment where we're scrutinized. We have higher demands and narrow margins of error. So Liz Delgado, Maya Bellman-Schramm from Germany, Rob Adamowski, US here, Corcept Therapeutics, they will discuss that topic. And then the final panel that we have is on longevity. So here's a topic that, John, you're very well versed in, and you have done a lot of research in this area. In fact, competed last year with a concept in this area. And we have some amazing speakers again: David Barzilai, Dominic Thor, and Mishkat Shehata. Okay, they will provide us with that dose of optimism and that duty that we all have and share in healthcare to drive longevity medicine forward. And then we'll conclude and let the games begin. That's when the competition will begin, after competitors will have introduced themselves, gotten to know everyone. We'll share some highlights, some summaries, some of the best moments from the day of learning, and begin our competition. So that's our teaser. That's what we're looking forward to October 6th. John, there's other topics. There's a lot of times for breaks. Any comments first on the agenda?
Obviously, if you're not going to compete, it's worth following the conference and joining in with the conference, because there's a lot you can learn from novelty. I spend a lot of my time trying to keep myself up to speed with changes and new research and new ideas, and this is another way to do it. So you don't have to be a competitor to participate, but it is worth, actually, if you've got your own ideas you wish to promote, then this is one of the few opportunities you can do that in. So definitely now get on with it. Sign up.
Yep. All right. So how you can sign up, that will be available in a comment. So look at the comment after you watch this video. All right. And the website is also going to have updates from now on every day. So, for example, I'm going to share the website here. Okay, you can register easily, read more about it, see some of the format, the playlist from last year, from the last 3 years of learning. Okay, uh, and as well as meet some of our speakers who have been updated now. And you can see all of the speakers we have so far highlighted, okay, on the website. The agenda in its detail and times will also be updated very soon. And with that, we can't wait for the event. So we invite you. This is a personal invitation and a challenge that you don't want to miss and you will not forget. All right, October 6th. See you soon, John. Any final words?
That's it. Be there or be square. You know.
Yeah. All right. Very well.
Okay.